Okay, guys, someone asked me how often can someone go to hospital for a check in a year. So now I decided to make it official publicly for everyone to understand this. There are some reasons that can make someone to go to hospital for a checkup. We have a lot of factors like age. Also, we have factors like health history, and equally, we also have factors like recommendations from the hospital by your healthcare provider, like your doctor or your nurse that's in charge of your case. So, why did I mention this? Because there are some age-related issues, especially the age all these adults. You need to be going to hospital for a checkup because when you are getting old, there are there are some health issues that we'll be experiencing at that point. We have some age-related issues. So if you are an adult and you are not going to hospital, you're not doing yourself any good, because if you are going to hospital, it's an opportunity for you to verify or dictate any problem ahead of time so you can be able to stop it from occurring. But if you fail to do so, you are calling sickness. There's some things you need to check and know what the problem is. You begin to tackle that problem on time than leaving it. It begin to multiply and begin to cause a lot of harm to your health. So that's why age is very important for everyone, especially the adults, to go to hospital and know if they're having any issues that will affect them because of their age. When people are getting old, there is possibility of them developing some sicknesses. It's normal. It's normal. Now, another thing again is, I made mention of health history. What I mean by health history is like some people's or families have some issues, some sicknesses or disease that runs in their lineage. So if you notice that you have some diseases or some health issues that runs in your lineage, don't allow that to happen before you begin to go to hospital. They say that prevention is better than cure. So when you go to hospital and see a doctor to check your health, if you're having such issue, you begin to tackle it on time. There are some things you need to do so that those things will not get to worse. Or if you have not developed such, there are some things you need to be, as in some health education you need to acquire from the doctor or from the nurses, so that you will not fall victim of that particular sickness. There's some preventive measures they will give you, which if you follow it accordingly, fortunately to you, you may not have or develop that kind of sickness. You may be free from that. Running disease in the line, it doesn't mean that it will affect everybody. It depends on your own body, on your own body system, and how you live your lifestyle. It also made mention of recommendation, like giving you a recommendation by your healthcare provider. Your doctor may recommend a particular thing to you, like you need to do some screening tests, you need to do some series of tests. You need that kind of recommendations require you to go to hospital. So all these are the things that can make you to go to hospital within a year. So a lot of things can make someone to go to hospital. There are some people that have issues like diabetes, blood pressure. They need to be monitored. They need to be monitored. So you cannot say because you've seen a doctor, therefore you don't need to go to hospital again. They have given you drugs. After taking those drugs, you can stay at home. You can no. You need to go to hospital because you're under management. All those drugs is management drugs. So you need to take it according to doctor's instruction. After taking them, you also go to check up and know if those drugs is working. These are the things that will make someone to go to hospital annually. As someone asked me, I used to believe that that listening, I believe that you learn one or two things. Thanks and see you next time. I'm your nurse, Stella Ike.